Raise your hand if you did that today. Brush your teeth before school. Excellent. Pat yourselves on the back. Good job.
On a normal day, Mary Mcclean is the Metro Public Health Dental Program Coordinator. But today at Inglewood Elementary School in East Nashville, she's the Tooth Fairy.
All about your teeth.
Mary teaches the importance of dental health to more than 10,000 children in Davidson County every year.
We're going to tickle his gums while we brush his teeth.
Taking care of your teeth is part of taking care of your whole body. When you have an infection in your tooth, you have an infection in your body. When children lose teeth early in life, they're setting themselves up for having more problems with their permanent teeth as well.
Tooth decay is the single most common chronic childhood disease in the U.S., according to the American Academy of Pediatrics. By the age of 8, about 52% of children have already experienced decay.
Every day in our schools, there are children with abscessed teeth that are in pain. This is what we are trying to help eradicate in Davidson County. You cannot learn if you are crying with your head on the desk because you're in pain.
Who can help him?
Among low-income children, almost 50% of tooth decay remains untreated. Children of certain racial and ethnic groups have 3 times more untreated decay and missing teeth due to cavities than other children.
Some of the disparity issues revolve around access to care. If we don't have low-cost options for parents that are on the edge trying to make a living and put food on the table, then they don't have any options for taking their kids to the dentist.
Nashville's burgeoning immigrant populations bring additional challenges to tackling poor dental health among school children.
The children I see with the most unmet need are the new arrivals. Their needs go all the way from dental hygiene instruction. They just may not know how to take care of their teeth. And a lot of them will have rampant decay, and they need a lot of restorative work.
We're seeing that the children aren't drinking the water because they're not used to it. They don't understand that in this country, our water system is very, very safe. And in this country, we have fluoride in our water system, which is one of the greatest public health innovations in my lifetime. It makes our teeth stronger. Well, if you come from a country where the water source is not safe, you drink sodas. You drink something out of a can or out of a bottle, and most things that are bottled, are not that great for your teeth. Water is the best thing.
To address the dental needs of under-resourced communities, Metro Nashville Public Health Department administers the School-Based Dental Prevention Project. The statewide program provides dental screenings, referrals, dental sealants, and educational programs in schools with more than 50% of the students on free and reduced lunch programs.
The sealant is cool because it's white like the tooth, and the plaque won't stick.
The presentations that the Tooth Fairy does are to get the kids to think about brushing their own teeth and accepting personal responsibility for what they're doing.
Right. So we're going to brush before school, after school, before I go to bed.
Dental prevention is always easier and less costly than dental treatment once the disease process has begun. There are also very easy interventions such as dental sealants. They're not costly, they're not painful, that prevent disease. You're a good brusher. The services that we provide are good because it establishes a positive relationship between the child and dental care early on and teaches them what they can do to take care of their own dental health.
The School-Based Dental Prevention Project has been one of the most successful oral health services in the state. Davidson County has seen a drastic decrease in untreated dental disease. In 2001, 44% of children who participated in the program suffered from untreated cavities. By 2010, that number had dropped to 22%.
Taking care of your teeth has to be done on a daily basis. The tooth structure is very, very strong, and it's designed to last a lifetime. Kids losing teeth and kids having huge holes in their permanent teeth is not something that our society, that our culture should be putting up with.
Major funding for NPT Reports, Children's Health Crisis, has been provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, where discovery brings hope, Vanderbilt University School of Medicine, Department of Pediatrics, Baptist Healing Trust, fostering access to compassionate health care in Middle Tennessee. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.